In 2023, SmileDirectClub filed for Chapter 11 bankruptcy.
Tonight, the SmileDirectClub is shutting down.
SmileDirectClub is shutting down immediately.
Nashville-based SmileDirectClub has filed for bankruptcy.
A company once valued at $9 billion collapsed. Just a few years earlier, it promised to change how millions smiled. No braces, no orthodontist visits, no $1,000 bills. Just a box delivered to your door, and the promise of a perfect smile in months. SmileDirectClub exploded onto the scene with a simple pitch: convenience, confidence, and affordability. Hundreds of smile shops opened across the U.S. International expansion followed. Investors poured billions into the vision. How could a company with millions of customers, global reach, and billions in valuation collapse so quickly? This is the story of ambition, innovation, overreach, and the high price of scaling healthcare too fast. Orthodontics has always been expensive and inconvenient. Traditional braces or Invisalign treatments often cost over $5,000, require multiple appointments, and insurance coverage is limited. Millions of adults wanted straighter teeth but faced time, cost, and hassle barriers. SmileDirectClub saw a chance to disrupt the system. Their solution: remote orthodontic care using at-home impression kits, 3D scanning technology, and minimal in-person supervision. Technology replaced the orthodontist, convenience replaced trust, and mass-produced clear aligners were shipped directly to customers. On paper, it was brilliant: fast, affordable, and scalable. But healthcare isn't software. Mistakes in teeth alignment can cause long-term issues. The company was betting it could scale risk like any consumer product, by ignoring that human oversight is crucial in medical care. Between 2015 and 2019, SmileDirectClub expanded at breakneck speed. Revenue jumped from $146 million to over $750 million, while marketing spend soared to nearly $481 million. Hundreds of smile shops opened across the U.S., and international operations in Canada and Australia were launched. Customers either visited smile shops for 3D scans or ordered at-home kits. Dental professionals reviewed scans remotely, and aligners were shipped periodically. Yet operational challenges emerged: delayed shipments, mid-treatment dropouts, and increasing refund requests. Investors were thrilled with the story: a tech-like disruption in dentistry. But behind the growth, costs were mounting, and the operational model was straining under its own ambition. Problems appeared quietly at first. Dentists and orthodontists raised concerns. Remote aligners could not handle complex cases. In-person monitoring was missing. Some customers suffered pain, gum problems, or bite damage. Regulatory scrutiny began. Professional associations raised alarms. Several states questioned whether SmileDirectClub was skirting medical laws. Meanwhile, customer acquisition costs skyrocketed. Aggressive TV advertising.
How long are you planning on keeping your new smile? Yeah, so shouldn't it be guaranteed for life? SmileDirectClub has this really clever name for it: Lifetime Smile Guarantee.
Influencer campaigns and costly mall locations drove massive spending. Many customers never finished treatment. Refunds increased. Brand trust eroded, and beyond numbers, real people were affected. Thousands were left mid-treatment with no refunds. Some continued paying despite service interruptions. Social media and forums overflowed with complaints.
There's a new trend in teeth straightening. They say it's for much less than the cost of traditional braces.
Yeah, but some patients complain that these at-home treatments aren't leaving them smiling, and they're spending thousands to go to the actual dentist, who then has to fix their teeth.
The human cost became painfully clear. The 2019 IPO marked both a peak and a turning point. SmileDirectClub was valued at $9 billion, but public markets demanded rapid, sustained growth. Installment plans delayed cash inflows, while marketing and customer acquisition costs remained enormous. Investors scrutinized every quarter, and leadership faced pressure to justify valuations. Decisions prioritized expansion over safety, with regulatory warnings and customer complaints often treated as obstacles to growth. The mismatch between hype and profitability became a central stress point, and the pressure to sustain growth became relentless. SmileDirectClub was founded in 2014 by Alex Fenkel and Jordan Katzman, entrepreneurs, not orthodontists. Their background wasn't healthcare, it was consumer business and retail. From the start, leadership viewed orthodontics as a market problem, not a medical one. The goal was to remove offices, appointments, and specialists to scale faster and cut costs. As the company grew, control stayed at the top. Dentists and orthodontists were part of the system, but they didn't lead it. Business strategy came before medical judgment. Under CEO leadership, growth became the priority. More smile shops, more customers, more revenue, all to justify a multi-billion-dollar valuation. Safety concerns were treated as friction. Regulatory warnings became obstacles. Customer complaints were accepted as the cost of scale. Leadership believed technology and branding could replace oversight and trust. In healthcare, that belief isn't innovation, it's risk. Legal and regulatory pressure intensified. Complaints arose in over 36 states. Lawsuits with suppliers and partners emerged. Professional associations criticized safety standards. These weren't minor hurdles. They were expensive, time-consuming, and publicly visible. Operational focus shifted from scaling safely to defending the business. Each misaligned tooth and each unhappy customer now became both a health risk and a PR problem.
My treatment abruptly ended. I was actually waiting on an extension for my treatment. I had sent in my impressions on the 22nd of November, and then last Saturday, obviously, found out that the company is no longer doing business.
While SmileDirectClub struggled, competitors moved in. Other DTC aligner companies began to chip away at pricing and trust. Market saturation intensified pressure on growth and margins. The promise of a low-cost, convenient alternative was no longer unique. Investors and customers started to question whether the company could deliver on its bold claims at scale. By the early 2020s, the fatal combination became undeniable. High fixed costs from smile shops, manufacturing, and logistics, massive marketing spend, delayed cash collection from installment plans. Revenue growth stagnated while losses mounted. Layoffs, store closures, and international pullbacks followed. But cash flow had already dried up. SmileDirectClub wasn't out of ideas. It was out of money. Every operational inefficiency, every marketing expense, and every delayed payment compounded the problem. Growth alone could not save the company. By the end, there was no dramatic collapse, no single scandal, just a slow tightening of options. Costs stayed high, growth slowed, capital dried up, and once investor confidence disappeared, the model had nowhere left to go. Chapter 11 in the fall. In 2023, SmileDirectClub filed for Chapter 11 bankruptcy.
Earlier this week, I told you about a company called SmileDirectClub shutting down. It's a telehealth company that sold teeth alignment devices like retainers and mouth guards. People used it as an option instead of going to an orthodontist. The company filed for bankruptcy back in September and on Friday announced that they were stopping operations immediately, leaving everyone that used the company in limbo.
Heavy debt, operational strain, and a business model reliant on constant growth proved unsustainable. The assumption that orthodontic care could be productized like software collapsed. Healthcare requires outcomes, oversight, and trust. When these break, brands collapse, no matter how compelling the pitch. Thousands of customers were left mid-treatment. Lawsuits mounted. The public perception of the brand was shattered. The collapse was not just financial, it was reputational and human. Lessons from a failed healthcare bet. SmileDirectClub didn't fail because it was innovative. It failed because it tried to scale healthcare like fast fashion. Fast, aggressive, and unsustainable. Lessons for business. Solving a real problem isn't enough. Branding and capital cannot replace operational strength. Speed without durability in healthcare is dangerous. The dream of affordable, remote orthodontic care is not dead. But the cautionary tale of SmileDirectClub is clear. Convenience cannot replace trust, and growth without a foundation leads to collapse. If you want to get into the details and read the full story, check out the complete article from the Pari Passu newsletter. Link in the video description.